And welcome back to Punchline. Now, President Uhuru Kenyatta is expected tomorrow to convene an extraordinary meeting of governors that is, among other things, expected to deliberate on the status of county preparedness in the wake of Covid-19. But the elephant in the room will be the disquiet brewing over the division of revenue, with certain counties opposing the county revenue formula. Well, joining us now is Kisumu Governor, Prof Anyang Nyong'o, and we're discussing these and more issues with him tonight. And thank you very much, Governor. Most welcome to Punchline.
Thank you, Anne.
So first, what are your expectations of tomorrow's meeting with the President?
Well, I think the agenda has been sent to us, and I think the meeting is going to be extremely important and intense. So one of the things we are going to be discussing is the state of preparedness for COVID-19 mitigation measures and dealing with the spread of the terrible virus. Preparedness at the county level and preparedness at national level as well. And I think we are also going to be discussing how the county governments and the national government cooperate in this endeavor. As you know, Anne, health is largely a devolved function, but at a moment like this, it's not so much the extent to which health is devolved that matters, it's the extent to which both levels of government work together to protect our people against the spread of COVID-19.
Right. I think that's a very important point, and I just want to pause on what you've said right now, because rightly health is devolved, but there is now a growing feeling that national government is doing much like what President Trump did with the states. It's pushing, it's sort of pushing the back on counties for their preparedness, for their response, for their action plans. Do you get a sense that perhaps national government is in some ways deferring to counties on this?
Well, that would be very unfortunate. I think what national government should do and ought to do is to see the extent to which, given this pandemic that nobody expected, given the fact that neither the national government nor ourselves was prepared for it, given the fact too that both levels of government need resources to tackle this pandemic, that's a debate we should be involved in. What level of preparedness do we have with regard to resources, with regard to making the populace aware of the virus, with regard to protective measures at both levels of government? So I don't think that's a question of pushing responsibility to the counties. Of course, we in the counties have been doing our best right from the very beginning to make sure that we take measures to mitigate against COVID. But we are facing challenges as much as the national government is facing challenges, as well the whole world is facing challenges about COVID-19, yes.
Right. What would you say those challenges are?
Those challenges, first one, people really do not know much about COVID-19. Yes, it is known that it's caused by this virus. It is known that it's spread by contact, and it is known too that if you take certain measures like washing hands and so on, having masks and avoiding crowded places and social distance. Yes, those are preventive measures that are known that work. But apart from that, there are certain things about the spread of the COVID-19 that we are still puzzled about. We say that if we do testing, we can know how it's spreading, where it is spreading, and so on. But surely, you cannot do testing in the whole Kenyan population. It's economically not possible. In terms of tests, it's not possible. So what type of tests should we do to tell us much more accurately the extent to which the virus is spreading or may spread? In Kisumu County, we decided to do what we call stratified random sampling of various strata of the population that are endangered by COVID-19 in various ways. For example, we know for certain that people over 58 are an endangered species. That includes myself. We know too that frontline line workers are an endangered species too. We know that those people taking security measures at our border points are endangered. So if we are doing a stratified random sample, we'll take bigger samples from this strata of the population and less sample from young people, so that we can afford the testing. And we know that stratified random sampling We know that if you take about 3,000 samples from a population about 1 million, you get a closely accurate result. So we need to use statistical methods which have been proven to work to try and know how many of our people are likely to get COVID and what measures we should take to prevent that spread. Yes.
Right. It has been reported that there has been disquiet with the leadership of the Council of Governors for failing to have a harmonized position on COVID-19. Is that the case? And is there now, going into tomorrow's meeting, consensus on a common strategy or a request that you as a Council of Governors will be putting forward to the President?
I'm personally not really worried about people debating and perhaps disagreeing on what strategies to take, because that's in itself useful. It means that people are concerned about a working strategy. But after discussions that we have had in the Council of Governors, I think we are reasonably agreed on what strategy to follow to combat COVID-19. First, the state of preparedness is important. We know that it's going to spread, so we must have measures that will respond to that spread. One of the things that is becoming debatable is the issue whether we should have a close down again after the first close down. I personally am not convinced that closing down the country is going to help, because the damage is already done. When you open Nairobi, Mombasa and so on, people have already traveled. Okay? But what we really need to know is, what is the nature and extent of community transmission? Once we have opened up, are we seeing any new phenomenon, any new difference in community transmission of the virus? Yes, in Kisumu we are, because before the opening, we only had about 2 cases in Kisumu. Right. Now we have 46. The majority of which are people coming from outside. The data is there. Right. So what we decided to do, if we know that the majority of people which have COVID-19 are from outside, then we must strengthen our border surveillance, make it much more rigorous, have a tracing system. When we come into Kisumu, we know where you are going, and that data is forwarded to both the national government officer, the grassroots, as well as county officers. For example, an assistant chief and a ward administrator can work together at that level, and they will mobilize community health workers to make sure that these people there's surveillance on these people, there's reporting. It's a much more demanding response than we have now. But if indeed we are concerned about fighting COVID-19, we must employ these much demanding methods for doing so, not have what I call chickening out and say, look, if we close down, things will be okay. No. I think the demanding response to COVID-19, to me, is much more important than thinking that a close down will help everything. But
Governor, isn't there also a case to be made in terms of the lockdowns? And I'm certainly not advocating for one, but simply explaining what at least I hear people say, is that it also allows the hospitals to be able to, not be overwhelmed, to be able to deal with a certain number of cases that are Does that rationale not make sense to you, not to overwhelm
yes. I mean, yes, you cannot wish away that rationale, yes. It is supposed that if you lock down, there will be less cases in hospitals, but I'm not quite sure that's the case. I personally think that whether you have a lockdown or not, the hospitals are still going to be overstressed. The health system is already under a great deal of stress, and it is going to be under a great deal of stress whether you lock down or not. So let us just prepare for the worst scenario. And I think if we prepare for the worst scenario, is much better than thinking that you can mitigate against the worst scenario by locking down. You talk about a worst scenario, and there has been a big question about what the big plan is for a worst-case scenario. For instance, we know that we have limited health infrastructure, yet we don't see the kind of massive rollout of even temporary facilities. Is this a failure to plan for that kind of worst-case scenario? Is it informed by science, for instance, our somewhat low fatality rate? And why do you think, whatever the case may be, that this grand plan, this planning for a worst-case scenario, is not being communicated to the public? Well, we should communicate to the public, definitely. I mean, communication should now be very intensified, and we should not be shy about talking about it. I think it's better to be open to the public and tell the public this is what is likely to happen. I mean, I was in Kakamega the other day with my colleague, Governor Oparanya, when some people in the social media and so on were attacking him about opening a new space for a cemetery to inter people in the unlikely event that mortalities increase. And he said, look, in the final analysis, we are all going to die anyway. So if we have a cemetery now, even if it is not used fully, in future it will be used gradually and not so intensely as we expect. So we shouldn't be shy of doing this just because we shall be saying that we expect death.
But is the plan there? I beg your pardon, sir. Is the plan there? Has it been communicated?
Yeah, I mean, the plan is there. Well, no. And that's why we're meeting the president. We're meeting the president to fine-tune the plan, to think much more critically about the plan. The plan is not perfect. Nor is the plan a closed-up exercise. I think the plan is an ongoing exercise that must be worked on. And I think part of the plan is first to accept that there could be a worst-case scenario. That's first. And secondly, to say that there are certain things that we need to do. One, we need to be prepared in terms of PPEs and so on, and in terms of our personnel. I would think myself that at this point in time, what we should do both at the county and national government level is to recall doctors who have retired, some who are unemployed and so on, and let the retired doctors, who are of course at over 60, undertake jobs in health facilities which don't put them on the front line. For example, the usual care that we give in hospitals. You know, people coming with high blood pressure or people wanting surgery, whatnot for other diseases. Maybe you could call people on retirement to come and continue with this safe area medical delivery services and leave the front care work to younger doctors and younger health personnel. We know we are going to need more people. Then we should look at the area in which we have people who are retired and not perhaps in the public system and do it. The other thing I wanted to say, actually I was very upset. I've been very upset for a long time to see that the private hospitals are charging more for testing than public facilities. The science is not different. There's no difference in science about testing. Why should a private hospitals like Nairobi Hospital or Aga Khan Hospital charge 10,000 shillings, whereas in the public hospitals the thing is much less? I think this is a case where the private hospitals should also rise up to national duty and understand that making profit out of the people's misery is not something they should be engaged in.
Right. You're absolutely right, and I'm sure Kenyans will agree with that sentiment. Yet at the same time, we are, I think, expecting next week in the Senate a report on the medical equipment leasing scheme, or is it scandal, where again, private partnership was supposedly, meant to help or increase the capacity of public facilities. What are your thoughts on the MES mess?
No, my thought is much wider than that. My thought is that COVID has taught us that private sector response to healthcare delivery based on profit making is out of date. It is proving out of date in the US, it's proving out of date elsewhere. In countries perhaps which are perhaps much more public oriented health systems, like the Scandinavian countries, response to COVID has been much better. You see what I mean?
Right.
But in countries where you have this very, very private sector-oriented health system, like cities like New York, it has been a disaster because the private healthcare is not really tuned to responding to a major public health crisis. So that should be reviewed, really. The private sector should review themselves. That really, are we here to make profit out of disease, or are we here to take care of people's health at a cost that people can afford? That means that our insurance system should also review itself. I think healthcare insurance in this country, since I was Minister for Medical Insurance, is too much loaded by the profit motive in the private health insurance system, which distorts delivery of healthcare to those who cannot afford it.
What is the solution? When government says we just don't have enough money, you know what our revenue shortfall is. We need public-private partnerships in all sectors, including healthcare. How would you tackle that issue?
I think Kenya has the potential of a very effective response to this, because already it has been shown that when the private sector responds to support public initiatives, it works. I mean, when they don't, then it doesn't work. And therefore, what we need to do is everybody just to do their best to make sure that what is needed to save people's lives is bolstered. The government must do its best, both at the national county level, put out all resources in this regard. The private sector should, because if people are not there, you are not going to sell your cars and your shoes and your garments to anybody, because they will have died and gone. So where's your market?
Correct.
Yes.
Correct. A final question on COVID before we switch gears. Much of the care that government is encouraging at this time is at-home care, with WHO having released some guidelines on the same. Now, the 2017 Health Act says that our herbalists or our indigenous healers should be integrated into our public health system. Should we be looking to more than conventional medicine for the answer on COVID?
We shouldn't be looking more than to just conventional medicine. I will tell you, I myself, I believe very strongly in herbal medicine. My mother treated us when we were kids, and even when we grew up, on herbal medicine, and it worked. Twice I was saved from a near crisis through herbal medicine. So I do believe that herbal medicine should be integrated in the healthcare system. China has done it, India has done it, many countries have done it. Even in the US, herbal medicine is an in thing. It's now being translated into called food supplements. Food supplements are nothing other than herbal medicine, really, but perhaps much more useful to the body than medicine itself, because the commercial medicine is too much mixed with chemicals and so on. Herbal medicine is much more closer to the origin of the medicine, which is plants, fruits, and natural things. Yeah. So I think, and it has been proven, by the way, that if you take supplements and use herbal things, like even people who drink this dawa and so on. I mean, it is said in the literature, if you read, that your strongest defense against COVID is to make sure that you have a healthy body.
Right. And
one of the things that you do when you take herbal medicine and you dig these plant-based fresh fruit, fresh drinks, and you eat fruit, is that your body has a better immune system against this kind of thing. So we should respect herbal health care deliverers and integrate that into the mainstream of healthcare delivery system in our nation.
All right. Governor, I'm going to move quite swiftly with our next set of questions, and I want to talk about what will certainly be the elephant in the room tomorrow, which is the county revenue formula, if you like. Now, beyond COVID-19, the debate, as you know, is still raging on that formula for sharing revenue to the counties. The majority whip in the Senate in the last 24 hours has seemed to say either support the formula or no BBI, calling them one and the same: 1 man, 1 shilling, 1 vote. Your take on this issue?
My take is that we shouldn't be issuing ultimata about this. I think ultimata don't help. Ultimata is just political brinkmanship. I don't think that's the best way to go. The best way to go is to say, look, okay, we have this formula. Is it going to work for us all or not? If not, what is the solution? And I'm sure that when they meet, when, for example, ODM and Jubilee meet, our two leaders, the discussion, I think, is bound to be much more rational and much more fair. Because I don't think taking grandstands and playing politics of brinkmanship is going to help anybody.
Yeah, but why has ODM not rallied senators to pass the third basis formula proposed by the CRA? Is there a party position on this?
I don't know, because I'm not in the Senate. I mean, we governors have taken the stand that there's a clear division of labor. Is the Senate to debate about this formula for division of revenue? If indeed they want the governors to come in and have a discourse with them, we are ready. But the point is that there must be a discourse which is open-ended, where people listen to reason rather than emotion, where people are prepared to give and take rather than take stands. And I think if we do that, then a solution will be found. And I'm quite sure that when these two sides of the Senate, from the Jubilee and ODM, meet our two leaders, I'm quite sure that a solution will be found.
Right. Let me sidestep that issue just briefly. And of course, you're aware of the death of President Mkapa, which impacts us because of his role in the National Accord of 2008. And it is cause for us to reflect on the journey as a nation regarding reconciliation. And BBI is in some ways a part of or a continuation of that process. Would you compare the National Accord to BBI at all in terms of the work we need to do as a country? Indeed, are they comparable at all, I suppose I should ask?
Well, there's definitely a similarity between the BBI and the National Accord. The National Accord, as its name suggests, means that the nation was in disaccord, and the nation needed to be brought together. So a document called the National Accord did bring the nation together and produced a very productive government, the coalition government. The coalition government did a lot. Among other things that the coalition government did was to deliver us a new constitution, something which had been eluding us for quite some time. And the coalition government also, under it, so many legislations were passed whose effect we are still seeing up to this very day. My take on this is the following, that when we have a national democratic front looking for a developmental state, then we are much more likely to go forward than if we have any other form of government in a country like ours. We have a society with tremendous diversity in opinion, in culture, in ethnic communities, and so on. And you need a united national democratic front to build the country. So I think a national developmental and democratic state is what we need. And you can only get it under our circumstances through a united front that arrives something like a national accord or a BBI. Now, what is important is the content of the BBI, in as much as what was important was the content of the national accord. If those writing the BBI can look at the national accord and its product and say, well, several years later, what do we need to do to bring the nation together and produce a regime that will lead us to build a national democratic and developmental state?
Right. You're using the term National Democratic Front, but, you know, civil society and others have put it this way, that BBI appears to be premised not on a democratic front, but really a friendship and agreement between two individuals, and that the problem with that kind of formula is what happens when the two individuals are not on the same page. And it is fathomable that that could very well be the case if the little tussles, if you like, we've seen over joint House leadership between ODM and Jubilee, or even now with a somewhat tussle over the division of revenue formula, are to be considered. You call it a democratic front. People say you're putting the future of the country on two men who could tomorrow wake up and decide they're not brothers.
Well, I mean, the two men are not acting in a vacuum, by the way. The two men are also responding to social forces in society which are looking for some form of change in that society which can lead us to a national democratic and developmental state. And therefore, if they are not there, it doesn't mean the country remains in a vacuum. It means that nature hates a vacuum, as they say. It will be filled. So I'm not so worried about the speculative argument that if they're not there, I don't think they're not going to be there. They will be there, of course. But speculating what happens when they're not there is neither here nor there.
Not if they're not there, sir, but if they're not friends, if they're not agreed.
No. Well, I mean, yes, there's a possibility, but that would not kill the spirit of BBI, which is based on social forces that have been trying to change this country for a long time, and whose face or whose representation are the two people are representing this interest in these social forces. They are not happening unto themselves, separate from the social forces to which they are responding.
All right. I'm going to wind up on a question of electoral reforms. As you know, from next month, we will be at least 2 years away from what should be the next election. And when you listen to civil society, again, or governance experts, they say that the political class was very quick to implement the bits of, for instance, the National Accord that concerned power, but not those on substantial reform, like recommendations on how to fix electoral processes. Is this essentially the same position where we find ourselves in now, again with BBI, that it is the primary issue to share power and not necessarily fix the electoral system in the way specifically ODM with its irreducible minimums had argued for in the last election?
But you see, that's why I'm saying that if the BBI is going to do anything, they should have a look at the National Accord. The National Accord was not just about sharing power. The National Code was about sharing power with a social, political, and economic content. It's the social, political, economic content on which the National Code was agreed that led to people rallying around having a new constitution. And of course, when we finally went to the referendum was very largely approved by the population for a new constitution. And that new constitution is not just about power sharing. That new constitution, a lot going for it. First, it's one of the most advanced Bill of Rights that we know. And so we expect that the BBI will look at the National Code, we look at the Constitution and say, what is it in the Constitution today that needs to fine-tune to produce what I call a better republic?
There was the recommendation by IBC that reform to electoral systems should only happen at least 2 years before the election. Again, like you said, that 2 years starts next month, or rather ends next month. So literally, what do you believe should happen now in terms of electoral reform and perhaps very specific reforms before we get into another electoral cycle?
Unfortunately, sometimes we cannot predict national calamities. I mean, COVID-19 is a national calamity. Once it struck us like a thunderbolt, we expected certain things to be affected. One of them is obeying that deadline that the IBC quite rightly put with regard to having changes on electoral reforms. But then what do you do when you have a calamity like COVID-19, which by its very nature has made things move a little bit slower? So I think the Bible says that laws are meant for men and not meant for laws. So we should look at that carefully and say, okay, what is it that is possible for us to do what we need to change our constitution in order to serve the nation and produce what I call a better republic? Yes. Right.
Governor, pleasure speaking to you, and all the best tomorrow. We will be watching and reporting here on Punchline.
Thank you so much, Anne.